All right, folks, well, it's 11 o'clock, so our panel can take their seats. We'll go ahead and get started. And Kevin was going to give an introduction.
Yes, well, thank you all for coming today. We wanted to brief the community with regards to COVID-19, the coronavirus. And so there were some questions that the community had regarding coronavirus. And so we're welcome to go through those. And we do have quite a crew here. And so we all have name tags. I don't think we have to do introductions. But Denise, maybe if you could kick it off, just kind of give us an update, and we'll just kind of go from there. We'll go through the questions.
Okay, sounds good. Well, just as far as our current situation, we have no cases of COVID-19 here in Mahaska County. There's 16 positive cases in Iowa. 14 are in Johnson County, 1 in Carroll County, and 1 in Pottawatomie County. And so far, those are all related to travel, either a cruise to Egypt or travel to California. And we have no evidence of person-to-person spread in Iowa. I'll pass to Jamie.
You're going to pass it to me? All right. So you want us to read our question and then?
Sure, that's fine.
Okay.
Yeah.
So emergency management was asked, how is Mahaska County Emergency Management helping the community plan? So I guess from my perspective, there's a couple of things that we're looking at very closely. One is the operation of the 911 center. Because we do take all the 911 calls, one is probably going to start getting a little higher call volume. But two, I want to make sure my staff's staying healthy, because if we lose our staff, it's hard to answer those calls with nobody there. So we are working on plans currently to make sure that our continuity of operation plan is up to snuff and is going to get us through this. And then, of course, as far as the community, we're working with all the different agencies. So we've met several times with different agencies. Yesterday we met with the hospitals, schools, William Penn, any businesses that have reached out to us or contacted us. We've discussed things with them. We've put up a webpage specific to the COVID-19 at mahaskaready.com, trying to get current information out there. So it's kind of a place that you can go and get that information, or the Mahaska Health Partnership website as well. So I think that's our main focus, is continue working with all the different agencies and partners to make sure that they have what they need to continue to provide the services that we do.
We also want to keep in mind that Mahaska Health, along with Iowa hospitals and health systems, they do conduct emergency preparedness training year-round. And so we're prepared for this, and we're thankful to have partners like Jamie and the rest of the crew to work through this.
I guess the next question is to the schools, and so I'll attempt to answer that one. And the question is, how are schools planning for potential risks associated with post-spring break travel as students return? The school does have an emergency plan that addresses illnesses such as this, and we are following that plan and taking the appropriate precautions. We are going to begin implementing after spring break a restriction on visitors into our classrooms. We will work with students, families, and staff that have traveled over spring break and that have concerns about either their health situation or self-quarantining because of that travel. We do have plans in place to work with those families and those students and those staff to help accommodate them. But as of right now, we are continuing with school as planned after spring break. Of course, next week is our spring break. Do Penn want to jump in on that
we'll
as well?
jump in, and I'll just say, as far as the post-spring break travel portion and all that Melissa talked about, our plans as far as moving forward. But we do know where our students have been. We are working on it right now. As far as athletic teams, we know where they're at. We also have a survey that went out to students that they have to fill out, letting us know where they have been over spring break. And so we'll be getting that data and being able to monitor those situations. Our sports medicine team, along with our athletic department, will be talking to those coaches and student athletes that have been in different locations throughout the last week, just to monitor the situation with them.
And in terms of our situation at William Penn, we are on spring break right now, so we're in a little bit different situation. So our students are coming back on Saturday potentially. And so what we are doing is we are staying open. However, we are allowing a temporary remote access
availability for students. Certainly with autoimmune issues, certainly if they've been traveling to areas that are deemed highly infected, and then in addition, students that are just very concerned or their parents are very concerned. So we are allowing an online, or rather a remote access situation that is available, and so it's a temporary one for right now, and we'll, as everybody is, continue to assess this because it's very fluid. But right now we do have a temporary remote option available for William Penn students, but we are open. So we are working through all of those details and what that means so that we are absolutely ready for when our students return. And we are working with our medical staff and the staff here at MHP to make sure that we're ready as well.
And I think one other thing to say is that, we've had a lot of students on campus still. So, I mean, not everything for spring break, so.
Right.
And then as far as, you'll touch on external events, but we're looking at our Penn Activity Center. I know there's a lot of community members that use that. We're looking at what type of access and finalizing a plan of what type of access will be allowed for that externally, and then we have an announcement on external events.
Sure, we do have external events that we host at William Penn, and we're happy to do that on a normal basis, but this is not normal, and so we are taking steps to limit those external events, primarily following some rules on social distancing that have been given, but in addition, it allows us to focus our facilities and food service staff on taking care of our campus, and really that has to be our top priority right now. They are stretched and they are doing additional measures as they should be, but we need to accommodate for that. So we're limiting external events right now and working on that communication as we speak.
And that resources in place. Part of the reason why that limitation is being put in place is to make sure that we have those proper resources in place to handle things like that. From an athletic side of things, Abu Ibrahim, our Director of Sports Medicine, and I will be talking with coaches later today, and we're putting some other procedural steps in just to make sure that we have everything square and ready to go just in case there's a potential outbreak.
And in addition to that, we are working with staff to make sure that we have everything ready. We do have a clinic on campus, and so we're working to make sure that that is accessible and students have access to that because that is the preferred location to go if they think they're symptomatic in any way or if they're just concerned. We are looking at putting mental health measures in place. That is an ongoing thing. We know there's a lot of concern and we don't want our students to feel isolated or stressed by that concern. So we're putting mental health measures in place, and then just basic logistics and facility measures we're putting in place as well. So those are active, fluid conversations that we are having around the clock right now.
So then the next question was, are there plans to shut down our schools? And that's kind of twofold. The plan right now is to continue with school as scheduled, beginning March 23rd at the end of spring break. We do have plans in place if the governor steps in, or the Iowa Department of Public Health or the Iowa Department of Education steps in and requires us to close. We do have plans in place to accommodate that. But as of now, we are not planning on shutting down unless we are directed to do so by the Iowa Department of Public Health, the Governor's Office, or the Iowa Department of Education.
And if I could just add to that, we met with all the schools yesterday, and that was the same thing said by North Mahaska, Eddyville, Blakesburg, Fremont, Oski Christian. So that was the same message that they all gave as well.
My understanding is the governor has scheduled a news conference at 1:30 this afternoon. We'll see what her message is at that point. And again, we will go with that directive.
And we are in that same boat. We have plans if we need to. We do already offer remote online classes, and so that's not an impossibility for us to just extend that. So we're able to do that if necessary as well. But that's not what we're doing currently.
I think those were the great questions for the schools.
We'll run into more of the.
Okay. Yeah, I guess actually, from a public health or Mahaska Health standpoint, we already touched on the cases in Iowa, no cases in Mahaska County. How concerned should the citizens of Mahaska County be? The majority of people are not going to have a severe illness. You're going to have common cold type symptoms or maybe flu type symptoms. Young, healthy individuals. I think the basketball player that tested positive, or one of them or two of them, they just kind of had more normal cold type symptoms, right? So, we're really wanting to protect our immunocompromised individuals, our elderly individuals. So I don't want the public to all of a sudden think, oh my gosh, if I get this, I'm going to die, or I might die, and I need to find out if I have it or not. If you have symptoms similar to a common cold, could it be this? Possibly, but it possibly could just be the common cold as well. And a lot of the coronavirus has been around, different types of it, for a long time, and it causes common cold symptoms, okay? So I don't think we need to go into a full-blown panic and just lock ourselves in our house and not go anywhere. Now, certain groups of people, I do think our elderly and our immunocompromised just need to be really careful, okay? And all of us need to be careful. Hand washing, when you go to the grocery store, go ahead and use the little wipes that they have, to clean that off. I think that's important. If you see somebody that appears ill, keep your distance from those people. If you're not feeling well, don't go visit grandma, or somebody else that's immunocompromised. Our elderly population, they probably do need to be kind of cautious. I guess I would advise the elderly population, particularly those over age 80 or anybody that's immunocompromised, to it may be a good idea just to kind of stay home, or not to be going out a lot. And if you are going out, being really careful, washing your hands frequently and trying to avoid rub your eyes and rubbing your nose and things of that nature. But a lot of the symptoms, like I say, are going to be somewhat cold, flu-ish type symptoms, and the majority of people are going to recover from that very well. So that kind of gets to what should an individual do if they feel ill, right? If you're concerned that you may have symptoms that are consistent with this. It's a virus, okay, so there's no real specific treatment for it. Treatment is supportive, Tylenol, ibuprofen, plenty of fluids, rest. If your symptoms become severe enough, if you're having difficulty breathing, high fever, lethargic, then we won't want to see you, okay? Come to the emergency room, be seen. Those types of individuals may need some additional help. Again, that help is supportive. That's kind of getting you in, maybe getting some IV fluids, things of that nature. But if you just have cough, cold symptoms like what you've had, in the past with a common cold, then I think, the appropriate thing would just be probably to stay home and rest, and hopefully the symptoms will get better, run their course over 10 days or 2 weeks or something of that nature. So, and again, avoid going and seeing people that are immunocompromised.
Our message is really to call before you present as well, so we can prepare and make sure that we're protected as healthcare workers too. So we've got some isolation rooms designated for that. Just give us a heads up. We have a banner on our website that reminds people to give us a call if they think that they might have this. So although if you have a medical emergency, we do need you to call, and you need to call 911, you can do that. We just ask that you let EMS know so they can protect themselves as well.
Yeah, I think we are limiting our visitors. I think it's just spouses, parents, to our inpatient people anyway, people that are coming to visit. So we have limited visits there. The testing process, we were kind of talking about that earlier. So, hospitalized individuals who have symptoms, they're consistent with this particular virus and, test negative for influenza, then we're going to test those individuals. People who have been exposed to individuals or areas that have tested positive for the coronavirus, then those people we can test as well. International travel to certain areas, and you could call, and I think we have a team that could tell you if you're having symptoms and if you've had travel to those areas, that we could test you. We're not testing just outpatient people that are feeling pretty good and just have symptoms that are more consistent with upper respiratory tract infections and so forth, unless you're severe enough to be hospitalized, I guess, unless you fall into one of those other high risk categories.
Yeah, well, really the three things. So we're looking at your symptoms and your exposure history and your travel history. So, but the testing guidelines do change quite rapidly. The new ones just came out yesterday from the state. Then there are tests available. We do have the supplies needed to collect those specimens and submit them to the state hygienic lab.
Yeah, the question is, what is the current guidance for on gatherings of people? So currently, there is no community spread of the COVID-19 in Iowa, and so IDPH isn't making any recommendations to cancel planned events or mass gatherings. Again, that's, if you have a situation where there may be people coming in from some of those areas, it's not wrong to cancel events. So I think that's it's a fluid situation, so as things evolve, if we find out that we have more people in Iowa coming up with it, then we're going to probably change that. Like kind of the schools and colleges have said, we're just watching it. There's people that are being tested, so we just want to keep an eye on what it's doing. And the big goal for public health is that we want it to come slowly and not in a mass where we can't, take care of the people that are coming up with it. So it's a process.
I'd like to touch on a couple of things that have been mentioned here. Jamie talked earlier about some of the things that EMA and 911 are implementing. On medical calls, the dispatchers are doing a much more thorough screening of callers. And if someone calls in needing an ambulance, that involves, their travel history that's been mentioned, some of their symptoms. And that's twofold. We need that information for the dispatchers, but they need to pass that on to the ambulance personnel. And I know the sheriff's office and the PD as well, we respond to all ambulance calls within the county and within the city if we're available. So we would like to have a heads up. If they've traveled to one of the countries listed and they've got the symptoms, we need to know that. We take a little more precaution, the gloves, the mask, that type of thing, prior to us getting there to assist them. It's also, we've implemented at the jail those same medical questions, the travel questions, the medical questions for anybody that's being admitted into the county jail. And there again, that's to warn the jailers, warn the deputies, to give them a heads up. I was asked a question earlier this week, what happens in the event me and my staff would happen to come down with this. I haven't met with him specifically, but I'm sure the chief of police here in Oskaloosa and I would work some type of arrangement out. I have touched base I belong to a group of sheriffs. Basically, it's the southeast Iowa quadrant of the state. We have quarterly meetings. I've reached out to some of them. They've assured me that they would be happy to help cover in the event that my staff would get sick. And I would do the same for them also.
So we're welcome to open up to any questions that you might have.
I think one other thing I'd like to add is if we were to get a case in Mahaska County, how would we know? Well, the Iowa Department of Public Health is tracking those by county, and they would let the local public health know, and we would be in touch with that person if they needed to be quarantined or followed up on. We would be, active in helping assist that in our county.
That was the question I was going to ask.
Okay.
I have another one for the schools. Is there anything in the attendance policy that might change due to this illness?
It is possible that we will relax some of the attendance requirements, specifically for students who have compromised immune systems or health issues that the parents are concerned about. The key there is communicating. The parents need to communicate with the school the reasons why they're holding their student out or their concerns, so that we can work a plan with those individual students and parents. And so good communication is the key. And yes, we might and will work with parents on the attendance rules.
And we are similar. Yes, we're working individually with students already that maybe have some immune issues that are making them nervous, but we are going to that remote option.
Yeah, that's why the remote option's there.
So the remote option is there, and in terms of understanding situations, it's evolving and fluid, and we are happy to work with our students and our faculty and staff, for that matter, on whatever we need to. So we're all understanding that it's fluid at this point.
Another question that we had is public health sending out email updates. So the Iowa Department of Public Health has their website, and they are updating that often, daily, if there's any changes or anything. So Mahaska Health also has a website that you can go to with information on updates. And then Jamie with EMA started a website too, just specific to the COVID-19 topics. So those are great resources to go to. The CDC is also a great resource to go to get update and accurate information.
And if we have any immediate need-to-know information that the public should have, we'll utilize the Mahaska alert system. So I would recommend if someone isn't signed up for the text message or emails, that they get signed up for Mahaska alert, because we can push that out. You know, we can circle part in Oskaloosa and just give it to those individuals, or we can do the whole county. So we'll definitely be getting notification. And that's been one of my big things since this kind of started, was making sure we're getting the right information out to the public. Because as you can see in today's world, everybody's running to Walmart to buy toilet paper and no one's really sure why. So it's very important that we get the right information out there, and that people stay calm, wash your hands, and enjoy the beautiful weather that will soon be here.
Jamie, how do you sign up for those updates?
You can actually go to MahaskaReady.com and click on Mahaska Alerts, and then there's a link there. Anybody watching this outside of Mahaska County, there's also links for all of our surrounding counties. They have alerting systems as well, so you can click on that and get county-specific alerts for yourself.
The school also has a school alert system, probably very similar. It's located on our district webpage as well, where you can click on it and sign up for school alerts. That is where we would announce any changes to schedules or emergency messages. We would do that through that messaging system. We also are putting updates on our website, not daily, but as we get information, we are keeping our news section up to date. We actually rolled out a new website today, so I'll take this opportunity to say that. But we rolled it out today. It is www.oskicsd.org, and we encourage everyone to go check the news out that's on our website.
That's a smart.
We had a couple other questions regarding workplaces and if they should implement work from home policies. So there's not official guidance about that at the current time. I think this is just a time where everyone's looking at their policies and what makes sense for them. So obviously we're at a time where technology exists to make that happen. Some people have jobs where they can work from home. Some people don't. Obviously we need our doctors to come in-house, things like that. So while there's not any official guidance, I would say just look at what works for you. We do have to think about if we would have an amount of the population who gets sick and they're not able to report to work, and the risks and benefits there. We also had a question about COVID-19 and when it is expected to peak. And obviously that's just a guess at this point. Patty talked a little bit about flattening the curve. We've seen that start to come out as a message in the media, and that's really what I think some of the social distancing techniques are aimed at. So if we were to have a huge number of people get sick at one time, that would stress the resources of the healthcare system across the nation, as we've seen in some other countries. So we really want to slow the spread to allow for resources to catch up and allow for everyone to be cared for the way they need to be cared for. So it's kind of a different way of thinking. We're not necessarily thinking so much about how do I keep from getting sick, how do I keep from getting sick and passing it on to someone who's at greater risk of higher illness.
And I do think it's good for the public to know that we are, with public health, the hospital, EMS, and emergency management, part of a coalition that meets monthly, and we plan for things like this. So the Iowa Department of Public Health gives us a lot of guidance from the federal government to the state and then at the local level. So we do plan for this. So this isn't something that they're just, we're taking a guess. We have plans in place, and we're just working through it as we're given different injects of what's changing. So
Our top priority is the safety of the community, and so we've been in constant contact with the Iowa Hospital Association and also National Hospital Association as well. So. All right. Any other questions of media or anything else? All right. Well, thank you, everybody. Appreciate it.
Thank you.